Good morning, everyone. Thank you very much for joining us for this, our second virtual community town hall. I'm Jim Skogsberg, President and CEO of Advocate Aurora Health, and I want to welcome our community members from across Wisconsin and Illinois. We look forward to sharing timely, important information with you and addressing your real-time questions, which is one of the benefits of this Facebook Live forum. Today, we have convened a panel of physician experts based largely on the questions you have asked regarding clinical services. So let me introduce them to you now. Dr. Rob Citrenberg, infectious disease. Rob, thanks for being with us. Dr. Tony Hampton, primary care. Tony, thank you. Dr. Bijoy Kandaria, cardiology. Bijoy, thanks so very much. Dr. Nicole Zaremba, breast surgical oncology. Nicole, thank you. And Dr. Frank Belmonte, pediatrician and chief medical officer of Advocate Children's Hospital. Panelists, want to thank you very much for participating today and for your service to our patients and to our communities. We're here to address the pandemic that we've been battling since March, but I feel compelled to speak to the pandemic that we as a nation have been battling since our birth. I hope you would agree that it would seem strange to begin this session with a business as usual approach because things are anything but business as usual. Recent events have reminded us here at Advocate Aurora Health that we must fully embrace and live out every day our core values of compassion, respect, and excellence. Our work is designed to help people live well, and by so doing, we believe we can make this world a better place for all. So let me turn to our panelists and invite you to make a comment, whatever's sort of on your heart this morning. Dr. Kandaria, do you mind?
So Jim, when we took the oath, we took an oath to serve every human being, and that's what all healthcare workers do. That oath carries over to Advocate Aurora. So from the perspective of healthcare providers, we want to serve everybody, whether they come from India, whether they come from Saudi Arabia, or they come from a neighboring place in the United States. So for me and for Advocate Aurora and our team, everybody is equal, and they deserve the same care that we offer to everybody else.
Thank you. Thank you so much. Dr. Belmonte.
Jim, the world is watching us and our children are watching us. So how we respond to this situation really will define us. And I can say, in working at Advocate Aurora Health for the last 16 years, I've never been so more proud to be a part of this organization. We came out early on. We had a really great statement against systemic racism, and I think it's what we believe in here. It's part of our value.
Yeah, thank you, Frank. Dr. Zaremba?
Jim, I would just echo the comments of many of my colleagues in that I'm very proud to be part of an organization that stands firmly against racism.
Yeah, well said, well said. Dr. Citrenberg?
I'm also very proud to work for an organization that takes this matter so seriously and has pledged to reverse it. Look at the COVID pandemic, which has disproportionately affected our underserved populations, our Black population, our Latino population, and really has shined a light on health outcomes inequalities in these populations, and we are pledged to do whatever we can to reverse those.
Thank you, Rob. Dr. Hampton?
Jim, as a person of color, I can say that for me, I'm just tired. And I think a lot of people who are protesting, they're just tired. So I remember when I was a resident doctor, I was followed for the first week by, the police. And I asked my non-African American colleagues were they followed, and the answer was no. When I entered the building, in a part of the building where the docs only enter, I was grabbed and asked where I was going. I asked my colleagues were they grabbed, they said no. And I still have fear in my heart every time I interact with a police officer. So I think people are just tired, and they're just looking for tangible change. And that's why, as my colleague just illustrated, we got on our knees yesterday, and that was something that our organization did to honor Mr. Floyd. We got an email this past Sunday from you saying that we are going to not tolerate inequity. And then I think as we move forward and we have our diversity and our diversity committee, we need to do tangible things. And I think as we continue to model that for other organizations, I think we'll hit the mark.
Thanks, Tony. Thanks very much. And thank you all for sharing that. It would have been odd not to begin this session with some comments about sort of the events that we're confronted with. But let's turn our attention to the COVID-19 pandemic and talk about the issues and concerns that you, our patients, our neighbors, our friends, have about seeking and receiving care in this environment. But before we begin, let me get a few housekeeping details out of the way. Please submit your questions in the field below, and we'll try to answer as many of them as we can in the time that we have available. Next, if we have technical difficulties, and we hope we don't, we'll make this video available on our Advocate Aurora Health Facebook page for later viewing. We also want you to know we have closed captioning when we push this out. And finally, please take the survey after the town hall to give us your feedback. It is important to us, and we plan to do more of these, so your feedback is very valuable. Okay, let's be honest. With so much information circulating about COVID-19 and all the discussion about reopening and what it means, it can be hard to separate fact from fiction. We know people are anxious about visiting their doctor or going to the emergency room or coming in for that surgery that was postponed when COVID struck us. Is it safe to come back, and what do I need to take care of now and what can wait seem to be the most frequently asked questions. We will ask our panelists to answer those and more of your questions while also sharing more details about our Safe Care Promise. But we begin with a little game of fact or fiction. So we're going to play fact or fiction right now. And Dr. Sittenberg, you're up first. Fact or fiction? Now that it's hot outside, the virus is going to spread less, so I don't need to be quite as worried about it when I'm outdoors. True or false?
It's mostly false, Jim. We know that coronaviruses in general tend to be seasonal viruses. They don't do as well in hot and humid weather. But we don't know about this virus particularly yet. The concern is that even in higher temperatures and humidity, the virus may be less active, but it's still out there. The problem with hot and humid weather is that people are congregating more too. So even if there is a beneficial effect from weather conditions, that can be easily negated by the fact that people are congregating so much more. So I wouldn't rely on any changes in the weather to make us feel more comfortable or to let down our guard.
You know, Rob, it's interesting. Because I've had the privilege of spending a lot of time with you and your infectious disease colleagues, it strikes me as a little bit odd when people talk about, oh, now it's really nice, I'm going to go outside. I keep asking, well, really, has the science changed? Has the science changed? And you've been such a great voice of saying, trust the science. So yeah, we want to be very cautious about that, or we might see that rebound. All right, let's go to our second contestant, Dr. Hampton. Fact or fiction? I missed a doctor's appointment during the height of the COVID crisis. My doctor is going to give me a call to reschedule, isn't he or she?
Well, I think that's a little bit more fiction, and I'll tell you why. We're going to do a lot within Advocate Aurora to make sure that we connect with our patients, but I always tell my patients it's really their responsibility to take care of their own health. That's really critical. We're still open for business, and imagine not managing those chronic illnesses that you have. If you don't do that, you can get really sick. So just recognize that we've done a lot of precautions, and let me give you an idea of some of the things that you'll discover. So if you come into the clinic, what you'll find is that we will make sure you have a mask if you don't have a mask. And I have to say this, please put it above your nose and below your mouth.
Thank you for that.
I had to get that out. And secondarily, we're going to check your temperature and make sure you don't have a fever and ask questions related to upper respiratory infection symptoms. We also will, you'll notice when you walk in the lobby, you'll see the chairs may be spread out. There's going to be some social distancing in the lobby, and you may find a virtual technology to help you register without having to have a face-to-face, which is really cool. And then you may even smell that scent of disinfectant because we're cleaning like never before. We also have hand sanitizers all over the place. So you could argue that things are safer now than they've ever been. So, and if you're not, feel like you need to learn more, go to aah.org/safecare. And with that Safe Care Promise, you'll learn more about the other things that we're doing.
Tony, thank you for laying that out, because that Safe Care Promise is so critical. We are anxious for our patients to understand they can come, they can trust us, they can be confident that we're going to take good care of them.
That's right.
Okay, the game continues. Yes, please, doctor.
Let me speak as a patient. I'm a physician, but also as a patient. And I also was in the same conundrum, saying that I need an elective visit with the cardiologist, and should I wait for his office to call me? And I said, but there's 1,600 other calls that are going to make. If I need help, I want to go, I want to reach out to his office, make an appointment, and I did that. And it is the safest environment. I can't imagine any other safe environment to go in as a patient. So, yes, I think what was echoed is I can speak as a patient that that is very, very true.
That's well said, and thank you for that perspective, both as cardiologist and, in this case, patient. That's very valuable. Continuing with our game, Dr. Zaremba, here's one for you. Fact or fiction, as a oncologist. It's time for my mammogram, or my colonoscopy. I should get it. True or false? Fact or fiction?
Jim, that's a true statement. It's a fact. We were delaying routine screening exams such as mammograms, colonoscopies, and lung cancer screenings, in addition to mold checks for skin cancer. However, we have reopened as far as all cancer screening goes, and we are at business as usual with some additional precautions to ensure both the safety of our patients and the safety of our employees. I treat breast cancer specifically, and we know that when breast cancer is caught early, it's a curable disease. Likewise, for any other cancers, the earlier it's caught, the better the prognosis. So we highly encourage all patients to keep up with their routine screenings.
Awesome. I mean, come in and get seen. Boy, we want to take good care of our communities, take good care of our patients. Come in. Don't hesitate. It's safe to come in. Okay, Dr. Candaria, fact or fiction? The health system is bogged down with COVID-19, and I shouldn't really call 911 unless I absolutely know that I'm in an emergency.
Absolute fiction. And I will again give my own example since I'm also a patient. So I had just returned from an overseas trip. I felt like I was having a flu, and it was right at the beginning of COVID. I called my manager, who happens to be a nurse, said, I'm going to stay at home for another day and I'll get better and come. She insisted that I come to the emergency room. She met me in the emergency room and got me through. The end result was I didn't have the flu, but I needed a bypass surgery, and I got that done at an Advocate Aurora system the same day, the fastest I have ever seen as a patient to have it done. 4 days later, I was out of the hospital, and another 4 days later, I was back at work. So absolute fiction. If you're having symptoms, if you're worried about it, yes, there is COVID, but Advocate Aurora has partitioned and is practicing safe care such that you are able to get the same high quality care with the same speed that you did before COVID. COVID, I think, is just a roadblock that we just have to be careful. And as a team from Advocate Aurora, we are extremely careful when patients walk in.
Yeah, thank you for sharing your personal experience and recognizing that this is a virus that we're going to be living with for a while. I mean, we're not expecting, a vaccine next week, are we? So this notion of how do we coexist, we're figuring that out. We've got it figured out at Advocate Aurora Health. Thank you so much. Fact or fiction? Dr. Belmonte, I'm coming to you. And this one strikes close to home for me, all right? So fact or fiction, my young kids can hug their grandparents again.
There's really no easy answer to this, Jim.
Oh, come on, Frank. Come on.
So honestly, as we learn more about transmission, I think we're understanding this virus, and I'll leave that part to Rob to unpack. But we're starting to understand it more. Really, virtual is still the best way, the safest way, but I think as we go through the summer, we're going to have to weigh risk and benefit in different situations. So as we have more interaction with our families, making it as safe as possible, people social distancing, limiting the size of gatherings, masking, those are all important ways to prevent transmission. And then individually, if you have underlying healthcare conditions that might put you at more risk, you're going to want to take a little bit more precautions. So that's the best I can do, Jim.
That's pretty good. We'll take it. We'll take it, Frank. Okay, thank you all very much, panelists. What we're going to do now is take your questions, and we've got it here in front of me on the iPad. I'll just sort of take them in the order that they're given me. I want to invite all of you as panelists. I know that you all have different specialties, but do not hesitate to weigh in if you have a comment or observation. The first question is hand sanitizer dangerous with overuse? Is hand sanitizer dangerous with overuse? Who wants that? We always look at our infectious disease doc. So, Rob?
I'll take that, Jim. Sure. No, it's not dangerous at all. In fact, it's so important to use. We know that one of the ways that this virus is transmitted is by contact. You can get the virus on your hands, and then you can touch your eyes, your nose, your mouth. You can actually infect yourself. Hand sanitizer is very effective. It's not harmful if used as directed, so please don't be shy about using hand sanitizer.
Yes, please.
Can I ask you a question? I go to the grocery store, I go to the food store, I go to the store, I try looking online, and hand sanitizers must be the most expensive commodity or unavailable.
Yeah, least available.
Is there
sure.
an alternative if I am not able to procure a hand sanitizer?
What do you think, Rob?
I'd try soap and water. Soap and water still works. It just takes longer. It takes about 20 to 30 seconds to wash your hands, and it may not be as readily available as hand sanitizer, but it still works really well.
There you go. Hand sanitizer is okay, and soap and water doesn't hurt either, right? Okay, next question. I've been staying home since March. Do I need to slowly reintroduce myself to other people to build up my immune system? So it's kind of an immune system question. Dr. Sidnerberg?
There's really no rational basis for slowly building up your immune system. I think the most important thing that we have to understand is, as Dr. Belmonte pointed out a little bit earlier, we can't stay inside forever. We have to figure out a safe way to get back into our society and back to do things. So you can get back out and do things just safely. So we still have to maintain our social distancing. We still have to maintain our masking when appropriate, when we can't social distance. But we need to just get out there, and I think this is a great time with nicer weather. It's a good time to practice those techniques outdoors.
Very good, thank you. We'll keep rolling here. With all the protests, no social distancing, and no masks, will we see another surge in COVID cases 14 days from now? I guess we would all say that the jury's out. We're very anxious about that, but we don't know for sure. Do you want to take a guess, or does anybody want to take a guess? Thoughts?
Yeah, I'll take a guess that we're concerned about it. We don't know. We are watching the situation very closely. It may not even be 2 weeks. It might be 3 or 4 weeks before we see a spike. So we are going to be paying very close attention to that, and it's probably more important now than ever to maintain those extra precautions.
Very good, very good. Where can I get an antibody test, and is there a cost? I know that there's a modest cost to it, but we want to talk about antibody testing?
So, Jim, I think it's important to recognize why you want to get an antibody test. An antibody test you want to get if you want to become a plasma donor, if you're worried about something, because antibodies thus far have not shown to protect you. So don't give up the social distancing, don't give up the face masks, don't have the kids go and hug the grandparents yet. But you can get it from your primary care physician. At the Advocate Aurora system, the leaders have made it very easy for me to order an antibody test and get it done in our labs. And fortunately, we have our own labs that do it, so it's not all that difficult. And yes, it's a modest cost. I just got mine done 2 days ago, and the cost was covered by insurance, so many insurance carriers will cover that.
And just for our viewing public here, what did it cost? Just so somebody has that. Was it $65?
It was $65.
$65. And I loved what you said, because it's very important in terms of instruction. You do need to have a physician order, correct? And there's a lot of ways that you can get that. I'm going to put you on the spot, Dr. Hampton, because I know before you came into the studio, I think you had 2 virtual visits literally in your car with patients. And I don't know if you ordered an antibody test today or not. I don't know.
Yeah. How cool is that I could be in my car getting ready for this interaction and to do a couple of visits. So, and the virtual visits are more than just an opportunity to interact with your patient and order a prescription or get a referral. I just recently, about a couple of weeks ago, had a patient who was part of our COPD class, and Dr. Richard Bone and Dixie Jarrett, who are part of our team, we've put these classes together. And I called the patient who's in the class, and I asked her how she's doing, and next thing you know, she starts crying. And I'm like, why are you crying? And she said, because my interaction with you and the interactions for my weekly COPD class are the only interactions I have. she didn't have anybody else. So what's cool about virtual visits is that it's an opportunity for us to help our patients in ways that we don't even think about.
Yeah.
Just to be a friend, somebody that can help them emotionally. So, and they love to see us on a video versus on a telephone. So I encourage all my clinicians and patients who are watching this to take advantage of that technology.
Yeah, and you pointed out so nicely, this is a trying time.
Yeah.
Regardless of medical circumstances, right? It's this isolation and kind of being sequestered off. That takes a toll on folks. So thank you for bringing that up.
In pediatrics, it's really allowed us to see some of our kids with chronic illness in their home environment.
Yeah.
It's really opened up the lines of communication. People are more comfortable. So we are confident that this is here to stay.
Very good. Okay, here's another one for you. I sing in a choir. Is it safe to go back to singing in a group? What precautions can be taken to ensure the safety and health of all of those involved? I think we've sort of talked about this, but let's be specific. What would you say to this member of the choir, Dr. Sittenberg?
Well, it's an interesting question. Back in the early part of our COVID epidemic in this country, there was a church choir out in Washington State, and one person in the church choir was infected and ended up infecting the majority of the people in the church choir just from singing. So you do have to be careful. You do have to maintain distance. I think that the advantage we have now that we didn't have back even a few months ago was the ability to do much more testing. So people can be tested much more easily. If there's any symptoms, obviously you don't want to go, but even if you don't have symptoms, that's something to consider, to be tested before you participate in a church choir. Singing is actually one of those activities that could spread virus through the air, so we want to be very careful about that particular activity. And obviously, anybody who's sick should not participate in such an activity.
Thank you. Thank you. Next question, Dr. Belmonte, clearly in your wheelhouse. What are some ways we can keep young kids safe when in public places since they cannot wear masks?
So really the rule is under 2, and part of it is developmentally they can't keep the mask on. So even if any of you tried to wrangle a 2-year-old to put a mask on, it's very difficult. But if everybody else is wearing the mask and you're providing that supervision to the child, it should be fine. We absolutely don't want masks on infants because it can actually occlude their airway. So I just think getting back to what Rob said, we're going to get back into society, we just have to do it smart. And if we do it smart, we're going to decrease the risk of transmission.
Yeah, thank you. And speaking of smart, we're thinking about smart restarts and smart reactivation. This next question has to do with primary care. So, Dr. Hampton, are you now accepting new patient visits for primary care, even if it's just a virtual visit?
Absolutely. I think when we first started, we were primarily saying that only the video visits could be with a new patient. Now we're a little bit more flexible with that. So we are accepting new patients using virtual technology. And to be honest with you, if I am choosing between a telephone and a video visit, if I'm meeting somebody for the first time, it would be more appropriate to see them, they can see me, and then it's a little bit more of a personal interaction. So we absolutely can see you as a new patient, and actually I want to see you when I actually interact with you. So
there you go.
Yeah.
Thank you. Here's one. I love these questions because I can tell people are writing sort of from their heart, really what's troubling them. And so here's someone saying, I'm elderly, I have many health issues, and staying home, but I do have family members living with me. Is it safe for the family member to go out for the day and then come back home? Is that actually spreading the virus, or am I overreacting? I think a lot of us have asked questions about, gosh, am I kind of overreacting to this a little bit? Again, Dr. Sittenberg, we'll start with you, but others might have comments as well.
Yeah, I don't think you're overreacting. It's actually it's a very important question. I think the most important part of that is that family member who goes out and then comes back home has to use safe behavior, has to maintain social distancing and masking and hand washing, and doing all of those things religiously will drastically reduce the chance of bringing that virus back home to the vulnerable family members.
Thank you. Any other comments from our panelists about that? Please.
There are some patients that we have encountered both in the U.S. and outside the country. And what they have done is that one particular patient that comes to mind is a patient who has had a cardiac transplant, the highest risk in that current population. And the family member goes out but does exactly what Rob said, extreme caution about sanitization and whatnot, and then comes back and lives in the same house, obviously avoids sitting very close to her father, but does it very, very well. And the whole family has done very well. So yes, it is something to be afraid of. It's not something you want to be cavalier about, but life has to go on, and with all the precautions and the safe care promise that you have made, it's not just for an Advocate Aurora hospital. I take that safe care promise at my home as well. So it does work.
Yeah, and the next question literally had to do with the example that you just spoke to, Dr. Candaria. Open heart surgery, 2 heart valves 2 years ago. I see people traveling, eating out, not social distancing, not wearing masks. How safe can it be right now? And as you said, be very careful, but social distance and mask, that's the way to go. I'd love to ask a question of you, Nicole. What are you advising your patients right now who might have had breast surgery recently about going out, not going out? Sort of a similar question, but someone that you may have performed surgery on. What's the advice and guidance you're providing?
So I am telling my patients to follow all of the same guidelines that we are telling the general population, and especially those with other underlying health conditions, to follow. Please maintain social distancing, wearing masks, proper hand sanitizing or hand washing if hand sanitizer is not available, and just to be overall careful. In regards to having cancer specifically, there have been a few recent studies that were published regarding cancer patients and how they might be affected differently should they be infected with the COVID-19 virus. And surprisingly enough, having cancer as an underlying condition, if it was an active or progressing cancer, was associated with a worse outcome should you have COVID-19. However, being treated for cancer, being in remission, even receiving chemotherapy, which is known to depress your immune system, was not associated with a worse outcome. So I encourage patients to continue to receive all of their cancer treatments that they were otherwise receiving and proceed with care as usual in order to increase their survival from that disease, and as well should they contract COVID-19.
Oh, such good advice. Such good advice. Thank you. Okay, next question. Have there been any updates on visitor restrictions? Are spouses allowed to accompany surgical patients? We're going back to you, Dr. Zaremba. Are spouses allowed to accompany surgical patients who have to stay overnight? We talked about this a little bit about visitation. Do you mind updating? And I think some of you have other patient kind of experiences.
So as far as surgical patients go, if a patient is having day surgery, meaning they are going home that same day after surgery, they are allowed one visitor with them for the entire day. If a patient is spending the night, they should be dropped off for surgery. They will have that procedure. The surgical team and the surgeon will be in touch with whomever that patient would like to have called with updates regarding how the patient is progressing and how surgery went. And when it's time for that patient to go home from the hospital and discharge orders are in place, that person is then allowed to have a visitor to come in, receive instructions, and then take that patient home.
Very good. A little different in the pediatric world, Dr. Belmonte?
So we are allowing one caregiver or parent to be at the bedside for the child during the duration of their stay. And I would just add, the visitor restrictions are part of our Safe Care Promise, right? So decreasing traffic and the cadence of traffic through our facilities really helps us to keep people socially distanced and safe, both our patients and our medical staff.
Excellent. Thank you. So here's a question that could have been written by any of us. My anxiety is at an all-time high. How do I cope and prepare myself for returning back into somewhat normal activity, everyday activities, and going into the public again? Boy,
Let me comment.
You must have everyone who's anxious.
I think we're all anxious. I was as anxious as anybody when we first started, and was happy to introduce virtual visits until my angst went away. But what I tell people is you have to think about the totality of how you're going to protect yourself. So every little thing you do will help you. So getting out of your house sometimes is probably going to reduce your anxiety. So sometimes I'll go for a jog, but I'm jogging in an open space. So my ventilation, the virus struggles in open air. So being outside and getting some air is probably something that's helpful. And if I'm in front of somebody, I'm going to try to keep my distance, my 6 feet, and then I may not talk to those people. I need to interact with people, but maybe I'm not going to talk for the duration that I normally do, because so I'm looking at ventilation, duration, distance, but you have to get out and actually start to interact. And you can do that virtually as well. To not take advantage of technology in this time, this is the time to learn the technology, and just seeing somebody and interacting is going to be good for your mental state. So I just encourage people to take advantage of that and benefit from all that.
Yeah, other comments?
I would say it's really been great to see families out taking walks in the forest preserves, on the trails. So like getting back to that piece also helps reduce anxiety. And then I think we can start getting back to normal. You just have to plan it. You have to be mindful, do I need hand sanitizer in my car? How do I interact? So as long as you're planning it and being mindful of the protection, it can be very safe.
Yeah, the other thing that we have said a lot here at Advocate Aurora Health is, right now it's okay not to be okay. We understand that. So reach out. Our physicians, Advocate Aurora Health is here to help you. So don't hesitate to reach out and get some help, get some folks to come alongside you during these very stressful and difficult times.
Jim, if I can add one thing too, Tony pointed this out, and I think it's very important for our community to know that we as physicians, we have the same anxiety that everybody else has. And I can tell you, I'm an infectious disease physician. In the very early parts of this pandemic, when we were first seeing patients in our hospitals, we as doctors, nurses, we were scared. We didn't know what to expect. We were concerned. We thought about, are we going to get sick? Are we going to affect our families? And we got used to it. We then had confidence in the PPE that we provided, that it worked, and we've gotten used to it. So we're not immune from that anxiety that everybody else is feeling.
Yeah, everybody here can relate to that question, can't we?
Jim, I'd like to add one
please.
other thing. Many of my colleagues have highlighted the availability of our virtual visits, which they are very convenient and are available. But speaking on terms of anxiety, many patients even have anxiety about attempting a virtual visit, logging onto the computer, maybe not having that app on their cell phone. So I did want to say that our clinics are also open and available for patients as needed. We are practicing all of our social distancing, sanitizing in between patients, and we are there in the clinic running regular hours and available for all patients. And in my world, it's a little bit difficult to do some virtual visits. If somebody has a breast mass, it's really hard for me to evaluate that over the telephone or via the computer. So I want to make sure that those patients know that we're here for them and we are able to see them and get them in promptly and have the appropriate care in place.
That's a great message. So once again, come in. It's okay. Come on in. We're happy to see you. Next question. Is COVID-19 more of a seasonal thing like the flu? Are we out of COVID season right now?
Well, Jim, we touched on that a little bit earlier, in that we think that there probably is a seasonal component to the coronavirus infection, but just being seasonal doesn't mean it's going to go away. And I think that we're going to see numbers decline probably a lot over the next couple of months. The concern is that once the fall and winter flu season comes up, that COVID will return, and maybe with a vengeance. We know experience from other pandemics, for example, the swine flu pandemic about 11 years ago. Swine flu is now part of our seasonal flu portfolio and has been every year since. So I think there's probably going to be a seasonal component, but just a change in seasons won't eradicate it from our population.
Thank you. Good question, too. Here's one. I know we don't have an obstetrician amongst us, but the writer says, I'm delivering my 7th child within the next weeks. What should I expect different than my past experience in delivering a baby?
I can comment on that.
Please.
As a pediatrician. So we've put some policies in place to keep everybody safe again. All women coming in labor, if it's an induced labor, then we're doing testing for COVID 24 hours prior. And if you're coming in labor, we're doing a rapid test, and we're having that evaluation done. You still are allowed to have a person in the room with you during the event, and we're trying to make it as normal as possible for women in bringing their babies into the world.
Okay, thank you, thank you. This next question really applies to all of you, because I would be surprised if each of you has not gotten this question from your patient population. Is it safe to get on an airplane? I'm worried about transferring the virus to others, because I'll be visiting others out of town. What are you advising your patients who call you and say, hey doc, can I jump on an airplane right now? Are you saying, yeah, be careful, mask? Or are you saying, not right now? This is a question that everybody's asking.
I'll chime in real quick. I thought about that because I was going to actually go and do an interview in California, so it ended up canceling it. But my point is this: so as I thought about it, I said, well, what's the issue? And the filters that they use on the plane are actually pretty good. So that's not the issue. The issue is the people who are sitting next to you, in front of you, behind you, and are they doing the right things? And I think the key is you're going to clean that area very well, and you're going to try to socially distance if possible. And hopefully the airlines are going to assist you. So I think the key is focus on the people around you and not so much the plane itself, because the plane's air is probably not too bad.
Yeah. The rest of you, similar advice and guidance, or?
Yeah, I had 2 kids who wanted to visit me and my wife, and the same thing, you have to follow the same guidance of wearing a mask, sanitizing your hands, not touching things, or if you're going to open the tray table, clean that and then do that. And one of the good things is that airlines themselves have stepped up to the disinfecting the airplanes and making it cleaner. As a matter of fact, there's a cartoon, and a real cartoon circulating, that one of the Middle Eastern airlines, everybody, all the flight crew dresses in hazmat things. Now, I would be scared to get on that plane, but the airlines are doing it, so it's not unsafe so long as you follow all of the guiding principles that were
So I'm just
shared.
curious, pressing the point a bit further, have any of you gotten on an airplane? I have not.
Not lately.
Yeah.
I think we're going to do a family road trip this summer.
You'll
I
be
think we're gonna
driving.
see a lot of those.
Yeah, exactly. Next question. Isn't wearing a mask worse for you after breathing in your carbon dioxide all day long? So let's talk about masking. Common question.
So I'll take that question. Since I go to cardiac rehab, and that was again the same thing, that, cardiac rehab, there's 20 people in different bikes, and I go to one of the Advocate Aurora hospitals, St. Luke's. The social distancing there is such that every other machine is blocked. And I wear a mask because it's a requirement. I actually was stupid enough or smart enough that I checked my saturation during the bicycle exercise and before and after, and it dropped by 1%.
Okay.
There is science, there is evidence, my own control, that no, it does not.
Right, but in your case, don't worry about that breathing in the mask. You're going to be just fine. That's really the message. Dr. Sittenberg?
It's one of those myths that circulates a lot on social media, and I can tell you there's no scientific evidence that says wearing a mask is harmful in terms of retaining carbon dioxide. So I hate to see people not wear masks just because of that particular concern.
Next question, and I think this comes from actually one of our own, so to speak. Is it likely that volunteers will return before the end of the year? Great question. Let me first of all say, if you're volunteering at Advocate Aurora Health, thank you so much. We are so grateful to the thousands of men and women that give their time to our organization in service of others. So just such a powerful part of our family. However, I wouldn't plan on returning necessarily before the end of the year. It's possible we might be bringing some folks back that have sort of unique skills and capabilities, but for the most part, we've said if you're working remotely, and clearly our volunteers are doing that today, if you're working remotely, plan on doing so for the rest of the year. Again, if we shorten that time frame, great. We'll let you know, but thank you for that question. Let's go to the next one. Do I need to disinfect my food from the grocery store? And I think we've all seen YouTubes and various videos about how you wipe down the box or the bag and so on. Thoughts about that, Doctor?
No. You don't. And I think that, while we know that contact, meaning that you can get the virus on your hand and then infect yourself, it's an important part of the transmission. I think if you get too granular, you can make yourself crazy. And so the most important thing is that if you're touching something and you're concerned, you can wash your hands and you can disinfect it. So it is not necessary. I've seen people in the grocery store literally take a product off the shelf, wipe it with a Clorox wipe, and then put it in their basket. It's not necessary. If you have any concerns, you could just disinfect your hands. The virus does not live very long or very well outside of the body. It's not necessary to spray your Amazon packages and leave them out in the hall for 3 days. Some people have been doing that. It's being mindful of what you're doing and not going crazy, because you could easily make yourself crazy if you get too granular on it.
Thank you.
And I'll just
please.
comment, these things called hands, it took, several years ago, I acquired the habit of not touching my face. And from the moment that I got that habit, it seems like I never got sick. So there's something about not touching your face. So I think if we spend less energy trying to wipe the grocery down and just don't touch your face. And if you do touch your face, you clean them first with some, soap or hand sanitizer. I think that's the key. If you put your focus because you're going to be touching a lot of stuff, the doorknob, the steering wheel, you're going to touch a ton of stuff that may be just as dangerous. So focus on your hands. And that's why I like masks, because it forces me. I've attempted to drink water and coffee with my mask on. Because and it didn't go very well. So just make sure your hands are out of your face. That's the biggest.
I tell you what, though, Tony, if you have mastered that, if you've disciplined yourself, I need a dose of.
I'm gonna put you in a class, special class.
Oh my goodness!
That's a great tip. I should also say that I see a lot of people wearing latex gloves out in public. I actually discourage it because your gloves get dirty as you go from place to place. You touch thing to thing. And you can't clean your gloves. You can clean your hands, you can't clean your gloves. So I think Tony's tips about training yourself not to touch your face and disinfecting your hands is the best advice.
And the second question was, how about wearing latex gloves while working, like in a library? So you have answered that question. How about this one? We're kind of coming full circle. Should we still be wearing masks in public? We've talked about 6-foot distancing. We've talked about being outdoors. We've talked about this virus is not gone. Should we still be wearing masks in public? Let's go with a short yes or no. Dr. Sittenberg?
Yes, if you can't social distance in public, then you should be wearing a mask.
And another masking question, what's the best way to sterilize my mask at home?
You don't need to sterilize your mask, you just have to keep it clean. You can keep wearing your mask, by the way, until it gets either wet or soiled or it breaks. So you really don't have, just be careful, set it aside in a clean area, but you don't need to sterilize your mask per se.
Thank you.
Rob, can I ask just a layperson question? What about the cloth masks? And are they washable, and therefore do they work?
Cloth masks are washable, and they do work. And remember, masks work by protecting others from us. We know that a lot of people have the virus and don't have symptoms and can spread it. So any type of facial barrier, if it's a surgical mask, if it's a procedure mask, if it's a cloth mask, can help dramatically reduce the amount of virus that comes out of our mouths and protects other people.
A question about visitors. We've chatted about this before, but we'll just come back to it. Any estimated dates when hospitals will open up to visitors once again? Well, we do have limited visitor capability or opportunities right now. The question might be more, when are we going to open our doors to sort of all visitors, and rather than one for the day, I think you were talking about, you can see multiple family members, multiple friends. That's going to be some time. That will be some time before we go there. It may even be once we have a vaccine. So we're going to be careful about this. Your safety, your health is most important to us. So don't be expecting us to open our doors to visitors anytime soon. We have very limited opportunity. Take full advantage of it, please. But we don't think that's being our patients' best interest in terms of their safety and their health.
And Jim, I would just...
Yeah, please.
I was going to say, along those lines, even though we might not be able to have all of our family members there for whether it be a clinic visit, day of surgery, or even while in the hospital for an extended stay, the physicians, the nurses, all the care team know how important it is for the family to remain informed and understand that sometimes the patients can't always communicate with their family in the way that they can understand everything that's going on. So we make it a high priority to stay in communication with the patient's family members and make sure everybody's in the know with what the plan is, what's going on, and that everybody feels comfortable.
Yeah, excellent. Thank you so much, Dr. Zerba. Yeah, you were going to say something, Frank?
I was just going to say, we take this really seriously because family-centered care is a real important aspect and a value for AAH. And, we're looking at it every week, and we will relax things when we know they're safe, but we're not going to move too quickly because we want to keep everybody safe.
Thank you. Thank you. Lots of questions about masking. So let me just kind of stay with it. This first one has to do with, let's make sure I'm reading it correctly. Oh, let me go to this other one. Are those with underlying medical conditions like diabetes that are treated with medication, are they still at greater risk of getting COVID than others? So the question is underlying disease, greater risk, yes, no, and this one particularly mentions diabetes. Any comments?
I could tell you that we have analyzed the population at St. Luke's, and untreated diabetes, much higher risk. Obesity, much higher risk. Chronic obstructive lung disease, much higher risk. Treated diabetics, they are at no different risk than another person who does not have diabetes.
Boy, another argument to see your doctor, get the care that you need. If you're getting treated, your risk goes way, way down. Dr. Sitterberg, any comments?
Yeah, I agree with that, and I think it also underscores the problems you see, why we have such a disproportionate burden of this disease in our underserved communities. Because the people in our underserved communities are more likely to have uncontrolled diabetes, uncontrolled high blood pressure, don't have the same access to health care that people in non-underserved populations have. So it's even more important for our Advocate Aurora Pledge to make sure that we are being able to provide that same care to all communities.
Thank you.
And let me just,
please.
One more comment. So when you think about your risk as a whole, diabetes, I've seen data that says you have a 7.3% risk of mortality. Then you add a hypertension, which is at 6%. Then you look at your age. And when you start adding these numbers up, your goal is to reduce your risk. So if I control my blood pressure, control my diabetes, now I can take my 20% risk down to maybe 5% or 10%. The goal is to, just reduce your risk.
Yeah. Thank you. So here's one that I'm glad we're getting to, and I'm a little worried that we're not going to be able to get to all these questions because I noted our time. It looks like we've got about 10 minutes left or so. So here's the question. I'm 77 years old. Is it safe to eat food that's delivered? I love eating out, but haven't been able to for fear of the virus. Is it safe to eat food that I have delivered to my home?
Absolutely.
I hope the answer is yes, personally.
It's absolutely safe. Well, that's what I've been doing for the last 3 months. So it's absolutely safe. And again, if there's any concerns about getting anything on your hands before you eat, wash your hands, which is something that you should probably be doing anyway. You should be washing your hands before you eat. So there's never been any evidence to suggest this virus can be transmitted by takeout food. So I would say keep doing it and just wash your hands.
Got it. So here's one that actually several questions. I'm kind of loading them in together. Is it safe to swim in outdoor swimming pools? Safe to go swimming outside? Yay or nay?
Yes. With the distancing, so that there are not 7 people in the lane, but yes, it is.
So it's more social, nothing inherent about chlorinated water or anything like that, correct?
Yeah, I think that's exactly right. It's so in your own swimming pool for sure, but the risk in public swimming pools is that people will be infringing upon the social distancing.
Yeah, all right. So similar question, can I go back to my fitness center? Is it safe to go to my fitness center? Same answer, social distancing, wiping down the equipment, those kinds of things, or is there something unique about fitness centers that we should be mindful of?
I think it's the same rule, right? And I think most businesses are employing those social distancing techniques, so I would say it's safe.
Very good, thank you. Dr. Belmonte, my child has severe asthma. She is 10. Should she wear a mask? Severe asthma and mask.
Asthma that's well controlled should not be a contraindication to wearing a mask. So if your child has uncontrolled asthma, then definitely you need to seek help from your physician to get it under control. Right.
Yeah. Okay, thank you. Similar for you, because it's about kids. How do we protect preschool and kindergarten children who attend school this fall? Classes are play-based, and social distancing is going to limit their ability to learn through interaction. So how do we protect preschool, kindergarten kids that are going back to school this fall, hopefully going back to school? Classes are play-based, social distancing is going to limit their ability.
We're working with a lot of school districts right now at Advocate Children's to try to figure out how to deal with the fall. I think we are going to see changes. I think we're going to see a mix of virtual and in-person. I think the actual physical space is going to change just like we're seeing in other businesses. I think it's too early to tell what it's going to look like, but we are definitely helping to inform from a medical standpoint how we do this.
So I'm going to pick on you, Dr. Zaremba, only because we had this conversation earlier, and I think it's right up your alley because of your recent activity. Do you consider it safe to visit a salon for haircuts and coloring service? You were sharing
Yes.
with us that you were so glad you finally got your haircut. Do you want to comment on that?
Yes, so clearly I do think it's safe. It's, again, employing those same guidelines that we've been harping on over and over and over again. At my salon, they were able to space out appointments. You waited in your car until they were ready for you. I had my temperature taken, and I was asked a series of questions about symptoms prior to being seated. When I was seated more than 6 feet away from any of the other patrons. Of course, the stylist had to be right behind me, but I was masked, she was masked, and I could see the other stylists in between other patrons were clearly wiping things down. So I guess it's ensuring the salon that you're going to and that they are practicing all these safety guidelines, and assuming they are, I think it's safe to go in and have it done.
There you go. Thank you. I think a lot of the audience just felt a lot better about that answer. All right, here's another one. It's sort of a repeat, but let's give it its due. My husband will not leave the house because he has asthma, high blood pressure, and he's over 60. Is he overly cautious? Are those risk factors? Let's talk again about underlying medical disease.
So, Jim, I think the same thing applies, that hypertension, over 60, asthma does increase the risk. But as was pointed out, if you are managing your hypertension well, your asthma is well controlled, then you have minimized the risk. And then if you follow all of the social distancing, hand washing, making sure you wear a mask, you're minimizing your risk, and it would be pretty okay for you to go out. Wouldn't again advise you go and hug your grandkid or somebody else, but everything else, yes, it would be okay, and it's pretty safe to do that.
Any other advice you'd give your patients in that circumstance?
I think that's great advice, and I think in the situation, Jim, that the example you gave, I don't think that patient is overdoing it. I think what he's doing is being mindful of what his conditions are, and being mindful of what your health conditions are and your risk for disease, he's going to be more likely to take the appropriate precautions. So I think knowing that, you can get out there and enjoy your life.
Thank you. Last question, then I'm going to give you all an opportunity to make any final comments. Here's the question, and it's appropriate that it be the last question. Is it safe to participate in the protests? It's kind of a loaded question, right? Because we have seen some activity that has resulted in injury, but I think they're really talking about the mass humanity, and I imagine we all say the same answer, which is, hey, you got to social distance, you got a mask. So, Rob, if you had a child, a young child who wanted to participate, would you advise them to exercise sort of that spirit of protest, or would you say, hey, it's not safe right now to do that? How would you advise one of your adult children?
You never want to discourage the spirit of protest. It's such an important part of our country, but to do it as safely as possible. I think that would absolutely include wearing a mask and wherever possible, keeping your distance. We are concerned about the potential for a spike in disease related to protests, but I think no matter what activity you do, you have to do it as safely as possible.
Any additional comments to that? Okay, I'm mindful of the time. I would love to give each of our panelists an opportunity to, and here's what I'm thinking. If you were talking to your patients right now, what one or two pieces of advice would you be giving them as we sort of ramp back up for activity and people are out more and so on, much like these questions that have taken place? But if you had one or two pieces of advice for your patients, what might they be? Dr. Zaremba.
Well, I would go back to one of our taglines here at Aurora Health. We try to help people live well. So I would tell all of my patients to just take care of yourself, whether it be managing your chronic illnesses, whether it be going in for your screening mammogram or your colonoscopy. Just take care of yourself, and while doing so, just make sure that you're doing it as safely as possible.
Very good. Dr. Hampton.
I'll essentially piggyback on what my colleague just said, and I use the acronym with my patients, NEST. So if you're going to be healthy, how do you do it? You have the right nutrition, and I tell people less sugar and starch. Sorry about that. E for exercise, S for less stress, more sleep, and the T is for how you think. And I honestly think the fear pandemic is hurting us as much as this pandemic of coronavirus. So we don't want to stop watching the news, guys. So just get the fear out your heart and let's start easing back into society.
Nest. I like that. Very good. Dr. Belmonte?
So I would say, regardless of what happens in the fall for school, get your child's annual physical exam. We want you, if it's scheduled, we are here to do the exam for you. And if it's not, schedule it. We are seeing some communities with up to 70% delay in immunizations, and then we're going to see an outbreak of measles or varicella. So it is important, and we are here for you. Schedule that appointment today.
That is great advice. Thank you. Dr. Sittenberg?
We've seen a pretty sharp reduction in the number of cases of COVID-19 in the last few weeks. That's expected to continue. The reason why that has happened is because of our behavior. Nothing's changed about the virus. The only thing that's changed is our behavior. And it's so important to still be vigilant in our behavior to continue to stay safe. You can go outside, you can go do things, but safely. And if we give up on the safety, then we are very likely to see a surge in cases again.
And Dr. Candaria?
Being the last. So I always tell my patients, my own example as a patient and as a physician and as a part of a healthcare provider team at Advocate Aurora. And as a patient, when I first walked in, when at the peak of the pandemic, my wife, my kids, my family members, and everybody said, you are a sitting time bomb and you're going to die. But I really feel that the leadership of Advocate Aurora, who put this Safe Care Promise, and not only put it on the website, but implemented, that I feel every day that I walk in. When I walked into this hospital, I could feel that. That gave me confidence. That gave all my colleagues, my family, everybody confidence. So I said, I'm going to come and work. And I tell my patients that if you need help, you need to be cared for. Just because there is COVID, don't not come to an Advocate Aurora facility, because we do what we write on our website.
Very good. Great advice from all of you. Thank you. Unfortunately, ladies and gentlemen, we are out of time. A special thank you to our physician panelists. They've been absolutely outstanding. Advocate Aurora Health is blessed to have a medical staff that's second to none. And you've just met and interacted with 5 of our finest. Please check out our website at aah.com and our social media channels for the latest news and to learn more about our Safe Care Promise. We are going to continue this conversation in the days and weeks ahead. To that end, your feedback is important to us, so please take 2 minutes and fill out that survey. We want to thank you for tuning in. More importantly, we want to thank you for your trust and confidence in Advocate Aurora Health. Until next time, stay safe.